Hi, I just wanted to what we are doing is this is something we are trying to work on out of box solutions. I can tell you about what is this out of box solutions, and I'll give you example of what is the off-label use of a traditional drug. I will start something with artemisinin. Artemisinin was a compound which was found in this drug was labeled to use for malaria. This particular thing was started in China, and it was pulled from that pine wood actually. So this artemisinin traditionally is used for malaria. And what we do here is we combine artemisinin and we, along with the hyperbaric oxygen, we give this to the patients who is having a cancer and all that, and this is giving us the great results. So this is again a out of box thinking, and this I'm working out with a lot of case studies and all that in hand, and we are here to show that just by adding this artemisinin, which is a malaria kind of, it's a drug originally thought for malaria, it's giving us very good results with cancer here. The concept is very simple, and to further elaborate on other things, I'll give a very simple example of a drug which is being very commonly used. You might be knowing of, all of you might be knowing about this. This is nothing but a progesterone. Progesterone is being used for people who are having issues with the low, particularly premenopausal ladies having problems with menstruation and all that. The progesterone is used. It's used in fertility medicine also. Here we are using progesterone in some other different scenario. I used in all cases of quick cerebral vascular accidents, and here we try to work with the patients who are having neuronal degeneration. This neuronal degeneration subsequent to anything which can be due to a cerebral vascular insult, or can be due to a kind of toxicity, or it's because of lack of oxygen. So many things are said, but the end result is the cellular death. The cellular death and the consequent edema, cytotoxic edema, what we say, is very well managed with this progesterone. Progesterone intravenously, or it can be given transdermally. We try to use with all of our severe patients with different shades. We try to work with this particular stuff in Parkinsonism, we can use it in autism, and whatnot basically. This is a neuroproductive. Progesterone is a neuron producing agent as such. Apart from that, I've been using something called EDTA. EDTA classically has been approved, and EDTA was used for people having hypercalcemia. And this was the classical, the classic indication for EDTA is hypercalcemia. There is one more indication which is called digital intoxication. This is also EDTA is used. The most important thing, EDTA is used for lead toxicity. Patients who are having high levels of lead, you give EDTA, it makes a difference. Off late, again this is an off-label indication of a drug. And I can say this molecule has helped us in so many cases of mostly vasculopathies. When I'm talking about vasculopathies, I'm talking about something like coronary artery disease, peripheral vascular disease, as well as cerebral vascular disease. All of these cases, if there is a high levels of free radical formation in the body, and we are able to cut down these free radicals by giving this EDTA, and EDTA helps in causing platelet G2B3A receptor, this particular thing, and this is one of the very good markers. Recently, DACB trial was done for this EDTA studies, and where it was found that for mostly diabetic patients as well as people who have suffering from micro circulation changes. As most of the diabetics, they have microangiopathy, and these are the people who get maximum response to the APA. This is what we have been doing since a very long time, and I've been working on something like DMSO, dimercaptosulfoxide, and this particular thing, we have got dimercapto. This is about a great sulfur donating ability in this particular thing. And I have been using this DMSO from allergy to cancer, almost all conditions. And this particular thing, again, I can always tell you, is a very good thing for cancer. And what we are trying to work it out is we are trying to stabilize the membrane, we're trying to make some microportions on the cell wall, and with that microportions, these particular things get properly the influx and outflux of the substrates. I'm talking about sodium, potassium, I'm talking about glucose, oxygen, I'm talking about pyruvic acid and lactic acid, which is dumped into the cell. This can be easily taken out once we add this DMSO. And once this DMSO, because of it makes the cell wall more resilient, and with this, most of the toxicity which is being waste product which are being dumped into the cell wall, which has been totally removed, and the oxygen formation improves, which causes a great deal in helping the cellular respiration, which more or less indirectly halts the cancer process. These are a few things which we want to work with at a bigger level, and I use one more transdermal product which is called a thing called magnesium oil, and this is one of the best things what we have got it. We keep doing this particular magnesium oil. This is very simple application. The magnesium is absorbed through the skin inside the body, because I have seen over the years oral magnesium, whatever you give in any formulation, it's not much absorbed. This gives us a very good transdermal magnesium. And the same way I try to work with something like lipophilic vitamin C. Lipophilic vitamin C, I can always tell you, this is what, and we try to work with lipophilic curcumin, we try to work with lipophilic glutathione as well. So these are the things which are in the areas of interest, and we feel that all our cancer patients and other patients, they do phenomenally well. I just give them vitamin C 2 grams or something like that orally. Hardly 10 to 15% is absorbed, and the rest is being passed out through the motions. The more you give vitamin C, it induces diarrhea and all that. So most of there is a intrinsic ability of the gut to absorb this vitamin C only to some limit. You can't expect the intestinal tract to absorb this much of vitamin C at one go. So for what we do is we try to use a lecithin molecule, try to see that lecithin is being covered with vitamin C. Then I can give 15, 20, 30 grams of vitamin C per orally. Makes a great sense. And thank you. Thanks for